Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It is really great to be with you today. Today's topic is all about case studies. And you could be preparing for your board exams, or you could just be preparing for your next exam in dental hygiene school. There are case studies from the beginning to the end of the program, and that is done intentionally. That is to help you become better at taking, understanding, and doing case studies. So, this episode is really designed to help you tackle case studies in a way that is meaningful. So I am going to just share what I put together here for you so that you can kind of see. If you are listening only, that's totally fine. If you are watching, that's also totally fine. Either way is fine, honestly. You will get the best out of it. So here's a couple strategies for you as a dental hygiene student. So the first thing you want to do, start with the big picture. When you read the case study that is in front of you, identify the patient's age, their medical history, their medications, and their lifestyle. Try to get a picture in your mind of who this person is. Highlight anything that immediately raises a flag to you. Diabetes, osteoporosis, smoking. Are they taking bisphosphonates? Are they pregnant? Things like that. Those are things that are highlights that are going to alter your treatment planning and how you proceed with your patient, how you prioritize their care. And the question you want to be asking yourself is, what systemic conditions will influence my oral findings or treatment? What are things that I might expect to see? The next thing you're going to do in your mind is pull out the chief complaint. You should underline them in the patient's own words, what they say, right? And it's usually in parentheses. Does the complaint match the clinical findings? Does it hint at a deeper issue, perhaps? I want you to scan that medical history for any oral implications. Look for systemic conditions that may alter the treatment, things like inflammation, healing, perio, risk level, right? Thanks. Here's some examples for you, what I mean by that. If you look at the radiographs, what's the focus on the radiographs? Did the case study provide you with a pan? Did they provide you with bite wings or full mouth comprehensive set of x-rays? When you're putting together your assessment priorities, what do you do first? What seems to be the issue for this patient? What is their blood pressure classification? So think about their risk level, right? What is their ASA? How about their diet? Is there something that would hint at an increased caries risk or some kind of deficiency? And did they note in the case study that the patient is taking medications? What are they using that medication for? What are the side effects of that medication? Those are the types of things that I want you to be thinking about. The next thing I want you to do is identify the key clinical findings, right? Gingival description, probing depths, bleeding on probing, recession, caries patterns, saliva flow, and thinking the whole time, what pattern do I see? What types of preventive strategies should I consider? What's the radiographic bone levels? Are there any pathologies evident? Then you're going to look for connections between systemic issues and oral findings. Think about the critical thinking that has to take place here and applying what you have learned in your didactic courses to the case study. Right? You know, the systemic condition has a biological effect, has an oral manifestation. Example of that would be diabetes, has an increased inflammatory response. There's deeper pockets, there's more bleeding, there's slower healing, there's more advanced disease progression as a result. So thinking about the patterns and the connections between what you see, what you know, and what you know in your mind. Identify those risk factors, right? Think about the local factors, the plaque, the recession, the calculus. Then think about the systemic factors like the medical conditions, the medications, and the age of the patient. And then think about the behavioral factors like the diet, the home care, and the smoking. Ask yourself this: which risk factors are modifiable? And of those modifiable risks, what's my plan to help them make those modifications? The next thing to strategize is to prioritize the treatment needs of the patient. Think of a plan and think of the priority. What is the most pressing issue? What are the urgent needs of that patient? If they're in pain, it makes it easy. If there's an infection, it makes it easy. So if they did not have a chief complaint of discomfort, but they have active infection in their tissue, then periodontal therapy would be the top priority. Things like that. What's their caries risk? Is their caries manageable? Is it under control? How are you going to prioritize this whole plan? And then think about the fluoride. Which fluoride would you use? What's best for this patient? What are the remineralization strategies for this patient? And what type of home care coaching do you think will be beneficial for this patient? You then want to, in your mind, match the interventions to the findings. Examples of this would be root caries would be a fluoride varnish and a 1.1% fluoride toothpaste. Xerostomia, you want to get some hydration in there, so maybe some xylitol or lozenges that are sugar-free. If they're diabetic, you want to get that inflammation under control and collaborate with the medical providers. If there's recession evident, we want to review that brushing and perhaps some desensitizing agents if that is brought up in the case study. The last thing I want you to do is end with a self-check, asking yourself these important questions. Did I connect the medical history to the oral findings? Did I justify my perio classification? Did I choose interventions that match the patient's risk? Did I consider fluoride, medications, and systemic factors when I was answering my questions related to this case study? So let's go over one example of a case study. This is Eleanor Hayes. She's 83 years old and she's a female. So let's talk about Eleanor's medical history. The first thing you want to think about is the fact that she's 83 years old. That means that she has a higher risk of disease, infection, and a compromised immune system when you compare her to, say, a 20-year-old. Her medical history reveals that she has osteoporosis and has taken bisphosphonate therapy for 6 years. She has a vitamin D deficiency. She has well-controlled hypertension. She uses a cane because she sometimes has mobility issues. When you're looking at her dental history, she has irregular dental visits over the past decade, and she reports sensitive roots and difficulty chewing on her left side. She brushes once a day, but that's the only thing she does for her oral health. She does drink sweetened tea throughout the day, and her chief complaint is that she feels like her teeth are getting weaker and the bottoms of them hurt when she drinks something cold. So right away, I want you to picture in your mind this person. Try to get a visual so that you can understand the exact needs of this patient. So when you are looking extraorally at her, she doesn't have any findings that come out of your extraoral exam. When you do an intraoral exam, you notice there's generalized recession, especially on those mandibular anteriors and premolars. She does show that she has some root decay, some class 5 root decay on 22 and 27. There are soft root lesions. And then 19 and 30 have deeper lesions that are getting closer to the pulp. You noted dry mouth, and you are considering that that may be age-related to this patient. When you're looking at her oral health assessment and you're looking at her home care regimen, you notice that there's moderate plaque accumulation along the cervical margins. And in her gingival assessment, you note that it's pale pink with rolled margins, mild bleeding on probing. She has 3 to 4 millimeter pockets and a localized 5 millimeter pocket on the mandibular molars of both sides. She has 20 to 30% horizontal bone loss, and radiolucency is consistent with the root caries that you have noted on the intraoral exam. There's no signs of osteonecrosis, and the patient, as we remember, is at high risk of that due to the bisphosphonate use. So think about the risk factors for your patient. There's age-related recession. She has osteoporosis. She has a vitamin D deficiency. She has xerostomia. She has frequent sugar intake because of the sweet tea. She has inadequate oral hygiene, and she's doing bisphosphonate therapy. So do you think she has more of a periodontal risk or a caries risk? Remember, she presented with active root caries, gingival recession, compromised bone health. Remember that vitamin D deficiency contributes to reduced bone density and slower healing. So she has a really high caries risk. She has a moderate periodontal risk. So here's my questions to you as you're thinking about this case study. How does osteoporosis influence periodontal assessment and treatment planning? What types of modifications should be made for a patient on long-term bisphosphonate therapy? And why are older adults at a higher risk for root caries, and how can we intervene? How does vitamin D deficiency impact oral health and healing? And what home care strategies would you prioritize for Mrs. Hayes? Those are the questions you want to know more about. So here's a question for you. Which factors most directly increase Mrs. Hayes's risk for developing root caries? Do you think it might be that she has her gingival recession with exposed roots? You betcha. And because she has age-related xerostomia, it ramps up that risk quite significantly. Couple that with the fact that she is drinking sweetened tea on a daily, that really ramps up her caries risk. Which systemic condition do you think Mrs. Hayes is most likely experiencing that contributes to her reduced bone density and slower healing? Do you think it's her vitamin D deficiency or maybe the xerostomia? I think it's the vitamin D deficiency because it slows down the healing. Now, what is the most appropriate dental hygiene intervention for her active root caries that she has? That is probably your primary focus. So would you apply a sodium fluoride varnish, or would you perform a full mouth series of radiographs? Or would you apply AAPF 1.23% fluoride? Or would you suggest the patient swish with a mouth rinse? So the correct answer for that would definitely be to apply a 5% sodium fluoride varnish for your patient. We know that's the most beneficial access to those root areas. And the other thing, what would you use to address the xerostomia and caries risk? Probably the best way to approach that would be to use the xylitol gum or lozenges to really help mitigate that use of the sweetened tea and increase the saliva flow in her mouth. What is her periodontal disease classification? So remember, she had 3 to 4 millimeter pockets generalized with localized 5 millimeter pockets on her mandibular molars. Radiographic bone loss of about 20 to 30% horizontal, and the clinical attachment loss was pretty consistent to moderate disease. There was no evidence of tooth loss due to periodontitis. So I would consider, based on the findings of what they've told us, that this patient is stage 2 and grade B because she does have systemic conditions of osteoporosis and vitamin D deficient, and that may modify the periodontal status, but does not indicate rapid production or depletion of bone. So I would say she's at moderate progression, which would put her in a grade B. And stage 2, there's measurable bone loss without the complexity factors that you would see in stage 3 and 4. So hopefully this entire presentation, well, let me just stop doing this. Good. Hopefully this entire presentation provides you with an example of how to walk yourself all the way through from start to finish on a case study. Case studies can feel really overwhelming at first because there's a lot of information tied to them and there's a lot going on as far as like there's just so much information, honestly. And you can kind of get a little overwhelmed with trying to remember all the information as you are kind of reading about it at the very same time. So it does feel a little bit like there's just too much information. I just want to remind you guys that case studies are one of those things that it's slow and steady. It will get easier as you do them. I know that it feels a little bit like the information is overwhelming, and it is not easy to take all the information from your didactic courses and try to recall and pull them out of your head for clinical application. That can be really hard. I want to make sure that you guys are aware of all the steps that should be going on in your head to give you your best chance of recall. Thank you for spending time with me today. I really hope that you're walking away with something that makes your journey in dental hygiene school feel a little lighter and maybe a little more possible. If this episode supported you, share it with your classmate who may need that reminder too. And if you want more tools, notes, and encouragement, you can always find them linked in my show description notes. Until next time, keep showing up for yourself, one step, one skill, and one breath at a time. I'll see you guys next week.